Good evening, everyone. So, we need to start with this topic today, which is the infective endocarditis. The prevention of endocarditis, we know that it is very uncommon disease, but it has very high mortality and morbidity rate. So, we need to be very sure and very cautious about this. Okay, and so that's the reason in the past, routinely used to prescribe the antibiotics for the patients who have any higher risk of cardiac conditions or who have higher risk of getting the infective endocarditis. Okay, but now the guidelines suggest that the procedure, the antibiotic which we prescribe to the patient before the procedure, so there are very much lesser chances that will prevent their endocarditis to happen. So this prophylaxis prevents very few cases. So what they mean by this is endocarditis related bacteremia. Endocarditis related bacteremia, you know that the bacteria which has which could be from the dental infection or from the dental treatment, it has gone and traveled to the heart and it is causing now the problems in the heart. So that is endocarditis related bacteremia is more likely to result from daily routine hygiene. So that's the reason they are eradicating the fact that previously we were prescribing so many antibiotics to the patient, but now they are saying that the risk of bacteremia, the risk of bacteria to go in the body, it can be from the daily oral hygiene activities, that is brushing and flossing as well. So then from any specific procedure that you would be doing in the clinic, so it is strongly advisable associated with the poor oral hygiene and gingival diseases. Okay, so they mentioned that it is important to maintain good oral hygiene because if there is any bad bugs or bacteria in the mouth coming from poor oral hygiene or any gum issues, that could also lead to endocarditis, even if the patient is not undergoing any dental treatment. Okay, so that's why they thought that prescribing the antibiotics irrationally is not good idea, and therefore the maintenance of good oral health and the hygiene is the more important than the use of antibiotic prophylaxis. Oral hygiene is important for the general population but particularly for the patients with the cardiac condition. So if your patient has any cardiac condition, you need to put more emphasis on the oral hygiene. Okay, so for general measures to prevent endocarditis, we will read in the following pages. Endocarditis can occur after hospitalization, especially in the older, sicker patient with the diabetes or chronic kidney disease. In fact, like the patient who has a lower immune system, so it can occur in them. This does not appear to be a sequelae to a particular procedure, but rather to problems such as intravascular catheter infections. So this emphasizes the need for infection prevention and control strategies in hospital. So it is common after hospitalization, so it is important that we maintain the good infection control, prevention and control in the hospitals. No randomized control trials have been performed to determine the role of antibiotic prophylaxis, and there are no human studies showing that it can prevent an infective endocarditis. So now the latest guideline did not really support the use of antibiotics, but we will be prescribing the antibiotic for few groups of the patient that we will read in the following pages. So, studies examining the impact of changes in guidelines have yielded conflicting results. Some studies indicate the incidence of infective endocarditis has not increased with restricted or no prophylaxis, but others suggest that infective endocarditis cases have increased after the adoption of new guidelines. So there is still a conflict. Some people say that you need to prescribe the antibiotic. Some studies state that you do not need to prescribe. So it is still conflicting. In response to these data, NICE modified their recommendations in 2016 to state that endocarditis prophylaxis is not routinely required. But now what you need to follow is that you are not routinely prescribing the patient, but at the end of the day it is your clinical judgment whether you will prescribe the patient the antibiotic or no. But according to the exam point of view, I would say that do not prescribe them. Okay, if you are in a real scenario like in your clinic, you can whatever you feel like, you can do that according to your clinical judgment. But according to the exam point of view, I won't suggest you to prescribe any antibiotic. Okay, so we will be prescribing the antibiotics to for the endocarditis prophylaxis for these groups of patients if they are undergoing these procedures. So first we will understand which groups of patients are at risk. So if the patient has prosthetic cardiac valve, then if they have any prosthetic material, so try to remember these 2 points together, like if they have prosthetic cardiac valve or any prosthetic material. Okay, then previous history of infective endocarditis. Then other point is the congenital heart disease. It means if they are unrepaired cyanotic defects or the repair defects with the residual defect, and the rheumatic heart disease in high risk patient. Okay, but now again they have changed this point, like in a high risk patient now they are prescribing the antibiotic for all the rheumatic heart disease patients, not only in high risk. Because here they mentioned that the high risk patient groups are those patients who have lower socioeconomic groups. Okay, and mainly the Moroi or the Pacific Islander people. So they base that it is because of the socioeconomic status, but now they recently changed this thing, and now you need to prescribe the antibiotic prophylaxis for all the rheumatic heart disease. Okay, so congenital heart disease patient, then history of infective endocarditis, rheumatic heart disease patient, and any prosthetic cardiac valves or prosthetic material. But you do not need to prescribe the antibiotic prophylaxis for the patient with mitral valve prolapse, septal defects, or cardiac implanted electronic devices. Okay, so such as pacemakers. So you do not need to do antibiotics for that. You only need to prescribe them if they have prosthetic cardiac valve or any prosthetic material such as cords or the angioplasty rings. Okay, then the what would be the procedures in which you will need to prescribe the antibiotics? So all the procedures in which would involve the manipulation of the gingiva or the periapical tissue or perforation of the oral mucosa. So, for example, extraction, implant placement, biopsy, removal of soft tissue of bone, subgingival scaling, and root planing, replanting avulse teeth. So I just used to remember these because there are these are few procedures and sometimes it's hard to remember. I used to just remember them whenever in any procedure you will see blood. So you need to prescribe the antibiotics. For example, extraction, there would be blood. Implant placement, it would be small surgery, so there would be blood. The biopsy, even the tissue removal, bone removal, subgingival scaling, you are going under the gum, so there will be blood, and root planing, replanting avulse teeth. So all of them does include. So that is the same point that they want to mention is the manipulation of the gum or the periapical tissue, because if you will do any of these procedures there would be bleeding, and so that's the reason. Okay. Then general measures to prevent infective endocarditis is data to support antibiotic prophylaxis are limited and many cases of infective endocarditis are not preceded by a procedure. Therefore, general preventive strategies and early recognition and treatment of infective endocarditis are important. All people, particularly those with cardiac abnormalities, should practice good oral hygiene. So, this is the most important point that you need to remember is the good oral hygiene, and they should have their regular dental checkups and preventive dental and periodontal treatment to ensure optimal oral health. For people with the cardiac condition listed in box 24, which are these peoples, so for them, preventive strategies are recommended. So, what are the preventive strategies? That is the twice yearly dental examination and scaling. Okay, timely treatment of if there is any bacterial infection in them, it is very important to do the timely treatment in those patients. Okay, then avoidance of intravascular catheters and invasive procedures unless necessary. Strict adherence to protocol for managing central and peripheral intravenous devices. Active discouragement of tattooing, piercing, tongue piercing, and intravenous drug use. An unexplained fever should be investigated in patients with a cardiac condition because it could be a sign of infective endocarditis and you need to refer the patient to their medical practitioner, which is the GP. Okay, so these are the preventive strategies that you need to do. If you notice any unexplained fever in those patients, then you need to refer the patient directly to their GP. Approach to endocarditis prophylaxis for dental procedure. So bacteremia associated with dental procedures usually involves viridans. So which is the bacteria which is leading to endocarditis is the viridans group of streptococci, which are known to cause infective endocarditis. Traditionally, the presence of significant bleeding associated with the dental procedure was assumed to be an indication of bacteremia and hence a need for prophylaxis. However, studies show that bleeding is a poor indicator of bacteremia from dental procedure. So, although they are stating here that the bleeding is the poor indicator for the bacteremia, so I was, it is not from this study, but I just used to a way of remembering these, procedures because if you are doing the filling you are not there is no bleeding so there is no need for prophylaxis. If you are just doing the supragingival scaling there would not be any like you are not going under the gums and there would not be a bleeding, so that's the reason. And even just the checkup there would be no bleeding, so there is no need for the antibiotics for the checkups as well. So it's just my way of remembering, but I was not pointing out to this topic, this indication. Then, self performed oral hygiene, which is the toothbrushing, flossing, and the use of oral irrigators, can produce a similar incidence of bacteremia to that caused by most dental procedures, which exclude extraction, because in the extraction, there would be a lot of chances of bacteremia. As these activities are performed more frequently than dental procedure, they have the potential to produce. So here they want you to understand that even if patient is doing the regular brushing or flossing, there is a bacteremia in his mouth. So that could also that has the same risk as you will do the dental procedure in the patient. So that's why they say that it's not the prescribing the antibiotics daily for any procedure is not recommended. And dental procedures are generally of longer duration than self performed oral hygiene. So, expose patients to a longer duration of bacteremia. Antibiotic prophylaxis is therefore warranted for some dental procedure for high risk patients. So, only for these procedures, for these patients only. Okay. Then what you need to do in the antibiotic, because the bacteria which is involved is the streptococci, so you just need to give the amoxicillin. So there is no need to prescribe the other antibiotic. Okay, so you can prescribe amoxicillin 2 gram orally 60 minutes before the procedures. Okay, so if oral is not possible, then you can also give the IM, but the time would be 30 minutes before the procedure. You can also give it IV within 60 minutes before the procedure. Okay, or you can all, it's your choice whether it is amoxicillin you need to give or you want to give, or the ampicillin. There is no change in that. And if the patient has a history of delayed non-severe hypersensitivity to penicillin, then cephalexin can be used in most cases. But if oral administration is not possible, then you can give the cefazolin 2 gram IM 30 minutes before the procedure, or IV within the 60 minutes before the procedure. But if the patient has immediate severe or non-severe or delayed severe hypersensitivity, then clindamycin 600 milligram orally 60 to 120 minutes before the procedure. So according to the exam point of view, I don't think you need to remember these doses. It's just because if the patient can take penicillin, then we will be prescribing him the amoxicillin or ampicillin. But if the patient cannot take the penicillin, then we will be prescribing him the clindamycin, which is the 600 milligram orally if the oral is possible. If the oral route is not possible, then 600 milligram IV within the 120 minutes before the procedure. There is some evidence that moxifloxacin may be used as an alternative for to clindamycin for patients with immediate or delayed severe hypersensitivity, but this has not been validated. So till now, either amoxicillin, or if the patient is hypersensitive, then clindamycin. Then considerations for patients recently or currently taking beta lactam. So if the patient is currently taking any other the antibiotics for any other indication, then what you need to change. In patient taking long-term benzathine benzyl penicillin for prevention of recurrent rheumatic fever, evidence suggests that the amoxicillin susceptibility to viridans streptococci in the oral flora is not significantly affected. So the consequence view is amoxicillin is appropriate. So even if the patient is taking this benzathine benzyl penicillin for the rheumatic fever, you can still prescribe him the amoxicillin dose as anaphylaxis. Sorry, prophylaxis, not the anaphylaxis. Okay, and in contrast, in patients currently taking or who have recently taken a course of beta lactam therapy, evidence suggests that the amoxicillin susceptibility may be affected. Therefore, a non-beta lactam antibiotic such as clindamycin may be considered. So, if the patient has taken benzathine benzyl penicillin, then you can safely prescribe the amoxicillin. But if the patient has taken any other beta lactam therapy like amoxicillin or ampicillin or any other antibiotic in recent period, then it would be better if you prescribe him the clindamycin. Okay, so if you want to do the further reading, you can open to these pages and you would know more. And tomorrow, hopefully, we will start with this topic here. Thank you so much, guys, for watching my video, and do share with your friends and like, share, and subscribe to my channel. Thank you so much. Have a good night.